So you said you have only Medicare. I mean, you have only Medicare, or you have other benefits too,
Like what?
like a VA from the military, TRICARE for life,
No,
retirement.
I never served in the military. They wanted me to go out there, and I told them I was too busy. I couldn't. I didn't have time to go out there.
All right.
It was
Hold on a
like
second.
they wanted to. I don't know where it was, Hawaii or maybe it was Guatemala. And they told me that I had to go out there. I told them I couldn't because I had allergies or I forgot why.
Okay, if you don't mind me asking you, which Medicare Advantage plan you have right now?
Well, they when I went in there last time, they were trying to charge me money, and I don't really have a lot of money on account of the ongoing litigation. You know what I mean? And
I mean,
so, if they want, if that's what they want, if they want money from me, they're gonna have a hard time getting it because I have all these other fees, especially when it comes to the whole when they said that it was fraud. It wasn't fraud.
hmm
It was never fraud. It was never about money, and they don't. Quite frankly, they don't have anything on me right now. And if they did, even if they did, they couldn't prove it. You know what I mean?
I
So
understand that.
yes. Well, I'm glad that you
So
understand because there's so many people out there in this world who don't understand. Am I right or am I wrong?
you're right. You're right.
Thank you.
Yes. Let me.
And so when they tried to push those charges on me, and I said, hey, I had nothing to do with it. Okay, they took me. It's you know how many I spent maybe 80 hours um, talking to the people at the law firm, and they said there's nothing there. They said there was nothing there.
All right, guys. See,
Wait, what?
uh,
You said what now?
Medicare plans. It's according Medicare plans you have. Okay.
Oh, right.
So it's
Yeah, good,
your
good.
healthcare insurance.
Okay.
Will you please confirm your first and last name for me?
What do you need that? What do you need that for?
Okay, I have to fill out a short form for you before you talk to my insurance license agent.
Insurance.
Yeah, I said healthcare insurance, like the United
Is
Healthcare
this John?
representative.
Is this John? Is this one of
No,
those
not
prank
John.
one of those prank calls?
Okay.
Listen,
See, it's
John,
not prank.
you're not gonna pull the wool over my eyes, okay? This isn't gonna be another
No,
one
it's
of your
not prank.
snow jobs where you just put one of these things
I
on
swear
YouTube or
it's not a
something,
prank. It's
huh?
not. It's not. It's not a prank. I swear it's not a prank.
Because I don't have
I don't
time. I
waste
don't have
time.
time in the day with all the
I won't
ongoing
take much time.
litigation, and I got to
I
go to
understand.
court tomorrow, so I got to get my
I understand.
huh?
This is just, yeah, I understand that this is just to upgrade your Medicare benefit. That's it, nothing other than that.
Oh, yeah,
I
good,
swear
good.
I'm not gonna waste your time. I'm
You
not gonna waste my time either.
you swear? You promise? You
Yeah,
promise me?
sure, I promise.
I want you to say, I, Tim, promise you, John, that this is not a prank.
I promise, son, that this isn't a prank.
Close enough.
Okay, so what we're gonna do here is that you're gonna talk to my licensed agent. They're gonna help you out with your benefits and see what we can upgrade it for you.
All right. Yep.
Uh,
Yep. Put them on. Let's get it. Let's get this over
all right.
with.
I thank you so much for trusting me. Okay, I'm not gonna betray you or something like that.
Yeah.
We
I'm
work
putting a lot
for.
of faith in you. You understand?
I understand. I understand. So, have you ever been to Hawkins?
You do what now?
Have you ever been to Hawkins?
What's that?
It's in Indiana. Hawkins.
No. I stay inside most of the time, unless I'm going up to Chicago to take care of some deals.
Hold on a second. Let me see. Robin Nankin. I'm gonna bring my license agent on the line. Her name's gonna be Robin Nankin. Okay. Hold on a second.
Okay.
Fill the form. Oh.
What's going on over there? You calling people or?
Yeah, yeah. No, 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 no. I'll bring my license agent on the line.
Feel
Hold on
like
a
there's a lot
second.
of sitting around going on here.
Yeah, it's general open enrollment period, so we're helping the citizen be on the best insurance. It's gonna
Insurance.
take a bit. Yeah, your United Healthcare plan.
I
We're
thought
gonna
that this was
upgrade it.
that this was about the litigation.
Medication. See, when it comes to your Medicare, it's gonna be about your doctor visits.
I don't understand any of
Expenses,
this stuff. It's
doctors.
just too complicated. You know, they make things so complicated nowadays. You can't even go to the grocery store because they're sold out of your favorite chips, and then the water, the distilled water. You need that for some things, but then it's gone. So then you go in there and
Yes.
the shelf is empty. But then what? They don't even restock it for 3 days. So what are you supposed to do?
Uh, See, right now it's general enrollment period for Medicare, so you can go check it out and upgrade your benefits. Okay? Do you receive any like a food card and a grocery card from United Healthcare?
Yeah, the grocery, that's what I'm talking about. But I mean, I can't blame them because they pay them barely anything. Those people are out there working so hard, but they don't get the recognition, like them and the teachers.
I understand it.
But they need to
All right.
start
So
putting the
whatever.
distilled water out there because I'm getting sick and tired of showing up there and the shelf is empty. Like, come on, it's water. It's not like we run out of water, right? We haven't run out of. Am I right or am I wrong? We haven't run out of water.
I understand that. You're right. You're right.
So I don't know
On the best.
why it's always empty. I mean, we got so much water. If it comes from the sky, yeah, you
Yeah,
go
I
outside
understand.
and then there's water out there in the sky. So I don't know.
So whatever it is, just have a word with my license agent, and they will tell you. All right.
Okay.
All right. Hold on a second.
Hi, this is Robin Ankin, licensed insurance agent. Who do I have the pleasure of speaking with today?
Hi, this is John.
Hi, John. How are you doing this morning?
I'm doing fine. I'm very happy that you got on the line because that last guy, I think he needs to drink some coffee or maybe a 5 hour energy because he was so slow. And yeah, we don't have all day for this. You know what I mean? I'm dying here.
All right, I understand, John. Well, I have had my coffee this morning, so
Good, wonderful.
yeah, we can help you out today.
That's good.
Just so you know, this call is monitored and recorded, and you're not required to share any health information unless it's needed to check your eligibility. Do you have your Medicare number handy so I can get you pulled up?
My Medicare number. It's upstairs in the dresser. I I have to go get it if you don't mind.
I don't mind at all, or you can provide me with your social instead, and we can pull you up that way.
Oh
That's
yes, yes. I have my social memorized ever since I was a wee lad.
Wee lad, love it. All right, I'm ready.
All right, are you ready?
Mm-hmm.
Okay, 317106471.
Okay, get that pulled up here. It'll second. Thinking. So, is there any specific benefits that you're calling about today that you're most interested in, or what's the situation? Why are we talking today? I guess is the question.
I don't really know. They called me. I thought it was a
Got it.
joke at first, or something
Oh
about
gosh.
my
Well, I'm glad
litigation.
that you are talking.
The ongoing
Oh gosh.
litigation that they're trying to get me with because they said I was committing fraud, but I never would have done that. I have no reason to commit fraud,
Oh my
so
God.
yeah, I know. If
That's
I was committing
horrible.
fraud, then how come I
I'm
don't
so
have any
sorry.
money? If I was committing
Yeah,
fraud, I would
right.
have so much money, but then they try and take you to court and try and prove that you have money, but
Yeah.
then the money's not there. So I don't know.
Let me
What can
verify
you
your
do?
social one more time. 317-10-6471.
You do what?
So I have 317-10-6471.
Yeah.
Okay, that's not pulling up with anything. You are on Medicare, correct? Not just Medicaid?
Yeah, so that's what the guy told me last time on the phone. He was speaking very slowly. It was total snooze fest. I thought I was going to pass out from his
Got it.
questions.
Yeah, so I'm not pulling you up in the system, unfortunately, John.
The system? What
Yes,
system?
correct. The Medicare system. The Medicare system?
Okay.
Are you on Medicare?
That's what he told me. He said that I was on Medicare and that he was going to get me a sweet deal on some doctor's visits and groceries. I told him that they don't
No,
put
but
the
what I'm
distilled water
asking
out
is,
there
are
anymore.
you on?
And so
But
if they
are
don't
you
put the
on
distilled
Medicare?
water out
You
there,
would know
how
if
am
you're
I
on
supposed to
Medicare.
do distilled water things. There's a lot of things out there that, you have to use. They say you have to use distilled water with. Like, how am I supposed to do any of that if they don't put it out on the shelf? Is my problem. So they
Oh,
got to get people
oh
out there,
no, I'm so
stock
sorry.
that shelf, get that shelf stocked. And I told them, the water. Hello?
Yes, John, you hear me?
Oh, hi. How are you?
C, do you have what C's asking is, do you have Medicare?
Yeah, I think so. Yeah. Wait, have you been here the whole time?
No, no, no. She told me, do you have, she asked you, do you have Medicare?
Yeah.
Do not respond. Do you have
What do
Medicare?
you mean? I've been talking this whole time.
You do have Medicare, right?
Yeah, of course.
Okay, so we're not pulling you up with your social. I want you to grab your Medicare card.
All right. You want my Best Buy card?
No, no, no. I want your Medicare card. Please grab your Medicare card.
Medicare card. The red,
Yeah,
white, and
it's
blue.
gonna be, yeah, it's red, white, and blue.
Red, white, and blue. All right. Hold on 1 second. I got to go get it.
Take your time. Do not rush.
Notes here
Take
somewhere.
your time.
So I'm not going to get to talk to Jill anymore, huh? Where'd she go?
Sorry, what's this?
What's that all about?
She's the insurance agent. She cannot waste a lot of time. And
Wasting
she thought
time?
you don't have Medicare.
Well, she needs to start
they're
doing her
licensed agent.
job and helping me out. If we're gonna save some money here, bada bing, bada boom, we gotta do something about all these numbers you keep on asking for. Because I've given out so much information, you guys could probably, I don't know, hack my bank account or something.
No, it's not related with bank accounts, okay?
Okay.
Actually, we don't keep your information in file, okay?
Okay.
So, please tell me when you're ready with your Medicare card, okay? It's red, white, and blue.
Yeah. Hold on.
Take your time.
Okay. All right. Are you ready?
Okay, all right. Let me transfer you. Hold on. Do you want to talk to her again or another licensed agent?
Someone else. She hung up on me, and that's very rude. And I wouldn't want to have to
Okay,
talk
so
to someone who's so, I don't know. You ever heard that story about the woman that, she looks at you and you turn to stone?
Okay, all right, all right. Hold on,
What's her
let me
name?
see who I can get it for you.
Matilda?
Her name is Robin.
No, it's not Matilda. She was one of those people like the Aquarius or Pisces or something.
Licensed agents are not.
And
Yeah, they're not so rude, but
there was she had snakes for hair. That was what it was. So then she looked at you, and then you turned to stone, or you know what I'm talking about? It was in the cartoons growing up.
yeah, let me get you the base one, okay? Hold on, let me see who I can get it for you. Okay, I have Kevin Moore. This one's gonna
Melinda.
be. No, it's gonna be a male licensed agent, okay?
No, it wasn't Melinda either. I have to do it on the Google Home later. They'll tell me what it was.
I'm sorry, what's that?
The Google Home. It's a little box. You put it in the corner, and then it talks to you. You can ask it for things like recipes and weather. The thing is it's so smart. It's wicked smart for how small it is,
All right.
We've really come a long way.
So can I?
Back in the
can I
day, you
transfer
couldn't
you
talk
now?
to things like that. Now they're having full-blown conversations. Do you know that?
I understand. Can I transfer you now?
Oh, yeah, sure.
All right, hold on. And see, you hear me, right?
You hear what?
You hear me, right?
Yeah, I'm here.
All right. Just go straight to the point. Make sure you don't mention me this time, okay?
I don't mention you?
Yeah. All right.
Wait, why not?
Transfer you. It's okay. It's okay. Whatever it is. All right. Hold on. I'm transferring you.
Wait, why wouldn't I mention you?
All calls are recorded for training and quality purposes, so it's okay. Hold on, I'm transferring.
Well, why would you even say that then? I'm confused.
Because we are brokers.
You're starting to freak me out. I don't understand why I wouldn't say that you're here. Is this a scam?
No, it's not a scam. It's not a scam.
You're acting very strange. I'm confused. I wouldn't be able to mention
just forget
that, huh?
Forget it. Forget it.
Okay.
Because it wastes a lot of time. That is why.
You're wasting time.
No, it's okay.
Why are you wasting time?
What I'm saying
is this John?
It's not. It's not. I don't even know who John is.
You don't know any Johns.
Yeah, I don't know who. So what I mean to say is Just go straight to the point and finish these things up.
Okay.
That's what I mean. Okay. All right. Let me translate you.
I mean, I've been trying. This is taking so long. I've been on the phone for at least
I
30
understand
minutes
that.
now, and I gotta take care of morning business, if you know what I mean.
I understand that. So this time, just provide your Medicare number, not your social. Okay. We
Okay.
cannot look you up in Medicare system, which is social. So we need
Yeah.
your Medicare number, which is in the red, white, and blue. All right. Here we go.
Hello.
Hold on.
This is Jarvis Bonds. I am a licensed agent with Quest on a recorded and monitored phone line. Who do I have the pleasure of speaking with today?
Hello.
Hello? Yes.
Yeah.
Can you hear me?
Yeah.
All right.
Hello.
How are you doing today?
I'm fine.
Can
How
you
are
hear me?
you? What?
Doing good, sir.
Hello.
I'm doing pretty good. Can you
Okay.
hear me?
Yes. Can you hear me?
Yes. I can hear
Hello.
you just fine. Are you
Yes. What's going on over there?
Hold on. Okay.
What the hell's going on over there?
I don't know. His connectivity is too slow. I just don't understand.
Taking very long to do this.
All right. Let me transfer you again. Okay.
All
I
right.
hope it's getting better now.
Hello, thank you for connecting. My name is Jarvis Bonds. I'm a licensed Medicare agent with Quest Solutions on a recorded and monitored phone line. You have the pleasure of speaking with today.
Hello. Can you hear me?
Yes, can you hear me?
Yes. Hello.
Okay. Do you have a hearing issue?
No? Why would you ask me that?
So you can hear me fine.
Yes, I can hear. I've heard you the whole time. Can you hear me?
All right, great. Now, yes, I can hear you. Now, if I can get your zip code so I can see all of the benefits in your area today.
Okay. Are you ready?
Yes, your zip code is?
46151.
All right, thank you. And which county are you currently in?
Morgan County.
All right, thank you so much, sir. Now, we do not offer every plan that is available in your area. We currently represent about 5 carriers with over 78 different plans. Now, to see all options, please contact Medicare.gov, call 1-800-Medicare, or your local state health insurance program to get information on all of your options. Now, sir, I do have your phone number listed here. And if this phone call were to get disconnected, excuse me, can I call you back at this number?
Okay.
All right. Now, I have one disclaimer that I need to read, and then we're going to check into the benefits that you qualify for. All right. Are you ready?
Yeah.
All right. Great. Now, I'm a licensed insurance agent. I'm not affiliated with or endorsed by any government agency. We are a brokerage that offers several Medicare plans in your area, such as Medicare Advantage, Medicare supplement plans, and optional supplemental benefits. Now, I would like to give you a brief overview of these plans. If you're only interested in certain ones, please let me know. Keep in mind, this conversation has no effect on your current or future health coverage unless you decide to enroll. Talking to me does not obligate you or automatically enroll you into any plan. So, sir, do I have your permission to discuss 2026 Medicare benefits with you today?
Okay.
All right. Thank you, sir. Now, do you currently make your own healthcare choices or do you have a legal power of attorney?
I already answered all these questions like 3 times now.
Okay. I have to ask, and this is just for compliance, okay? So, do you make
You
your
want
own
me to
healthcare choices,
comply?
or do you have a legal power? No,
Hey, I'm
I
not going to
have
be bullied
to.
around, okay?
Sir, I'm not bullying you. I'm just asking you a very simple question. All right. Now, do you make your own healthcare choices or do you have a legal power of attorney?
I make my own decisions.
All right. That was easy, sir. Now, do you currently
You
have
do what?
Medicare Parts A and B? Do you currently have Medicare Parts A and B?
Yes.
All right. And do you also receive Medicaid from your state, sir?
What? Hello?
Hello, John. You hear me?
Yeah.
What happened?
I don't know. I was talking to him and he just left. How
I don't
long
know.
is this going to
Wait a
take? Is it
second.
going to take a long time?
It's not gonna take a long time. I better call you back, okay?
What?
I'm really not. Can I call you back?
Why?
I'm really not feeling good right now.
You're not feeling good?
Yeah,
Hey, listen,
I can
whenever I
say that.
feel sick, what I do is I take the 1,000 milligram vitamin C, 50 milligram zinc, and then you get some chicken broth. You know what I mean? Have
Thank,
some of that with
thank you
some
so much.
crackers, and then that's gonna help. It soothes. It soothes the stomach. You know.
Yeah.
Well, I hope you feel better, and maybe you can call me back sometime. We can talk about things and such.
Let me call you. Let me see. I think I can call you back in the evening, right?
You'll feel better in the evening.
Maybe. Let's see. Maybe in the evening or by this week. Okay.
All right. Well, I hope you feel better.
Thank you so much. Thank you so much.
Because it's not good to walk around feeling sick, and that's been
Yeah.
going around. I know a lot of people who they got sick in the last week or so, and there's really nothing you can do. You just gotta wait it out. So don't
Yeah,
don't rush. Feel better, and hey, have you seen that new show called Stranger Things?
that's what I'm talking about. It happens in Hawkins.
Oh, oh, right, of course. I didn't realize because that's funny. Yeah, I was gonna say if you're not feeling so good, maybe kick back and relax and we'll watch a couple of. They call it binge watching. You know that when you sit there and you watch too much at once.
Mm.
Yeah, you just gotta get up every 30 minutes and do a twist, do a little, a twist, a hip twist, and you sit back down and you watch some more. But I was gonna say, that might help you heal up a little quicker. Just watch a couple,
All right, guys. So it was a pleasure talking to you. I really enjoy. So what I'm gonna do as soon as I feel better, maybe in the evening, I'll call you back and make sure I help you out. Okay? I really thank you so much for trusting me. I'm not. It's not a prank.
Yes, it's been very enjoyable, and you're a very kind person. Thank you very much. I hope you feel
All right.
better, and call me later. We'll talk it out. You know how to reach me.